love about my job, especially here at Stone Oak, is I love meeting the patients. Especially my older patients, because they have the best stories.
So what brings you in to see me today?
I feel like I have high blood pressure.
I was born and raised in Victoria, Texas. It's becoming a larger, small city. From there, I went directly from high school to Texas A&M, where I graduated with my first bachelor's degree in English and international studies, kind of non-related. From there, I came to San Antonio in 2010 and got my bachelor's in nursing at the UT Health Science Center. And at that point, I started working in the ER through my externship and was exposed to PAs and mid-levels and nurse practitioners, and that's when I knew that's what I wanted to, that's what I set my sights to do in the future. And from that point, after 3 years of nursing, I got enrolled to do my master's degree, which I finished a year ago through Texas State University in Round Rock. That's my education background. The way that I got interested in medicine and nursing was through a friend of mine who also went to Texas A&M. And that was her second career and she loved it. But she just told me how much more she enjoyed nursing, how it was awesome for her family and just how she liked talking to people and helping people. And that was exactly what I was looking for, something that I would love to do and it wouldn't feel like a job, that it would just feel like something that I wanted to do every day. And I'm really happy that I switched to nursing and medicine because it's exciting and different, and it's nice to talk to people every day and help them. So medicine is ever changing and there are many ways to keep up with it. The Board of Nursing actually has a requirement as nurse practitioners, a certain amount of hours every year that we have to do in order to stay current. I take it upon myself to use a variety of ways, such as there's Up to Date, which you can get on your computer or phone. I listen to podcasts, audio digest CDs. I go to conferences. I get out my old textbooks. I am so lucky to have my peers here. I have 5 different docs with amazing experience collectively that I can rely on when I need them. And so there's so many ways to keep abreast with the changes in medicine. So my mom is actually from Costa Rica, and I learned Spanish through her and also through going there and visiting my family. Now it's not academic Spanish, but I pretty much understand everything and I can read it. So if someone speaks to me slowly, I can definitely communicate. And if they had a medical problem, I could figure it out. In high school, I did lots of volunteering, but that was of course when I had summers off and lots more time. Now I got interested in the San Antonio Livestock and Rodeo. I'm on the medical committee, and not only do we help people at the rodeo, there's lots of medical emergencies that happen. We do first aid, but through that I met tons of paramedics and nurses, doctors, other nurse practitioners. A couple of them were my mentors in school. So that was sort of something that I did when I wasn't working, but I was still learning about medicine and patient care just through that experience. And I still do it. I've done it for 5 years and I love it. I don't get a lot of patients that are like brand new diabetic patients, but as we go through physicals and do people's lab work, there's a lot of people that are on the borderline, like they call it impaired fasting glucose. So I do see that. And then there's people that are already on medications and we titrate their medications and help them get closer to their A1C goals. So that's definitely a big part of what we do, especially here in San Antonio. There was a gentleman that came in and the chief complaint was abdominal pain. And he is doubled over the bed. He's not even sitting. He's in terrible pain. So I know this is really serious. And as I talk to him, we go through the exam and the history, and I tell him, I said, you know what? We need a stat CT. That's what we need in order to figure out what's really going on. And he said, okay. And I said, but don't worry. even though we don't have CT here, we have such good relationships with people around us, with specialists and Concord across the street. We can get you in. We had this gentleman an appointment in 30 minutes for a CT scan. He received his CT scan. We got the results within an hour. He was back that afternoon. We diagnosed him, we treated him, and it was a great outcome. And the interesting thing to me was, I guess coming from other backgrounds, he even told me, he said, well, I didn't know whether I should come here or to the ER or urgent care. And I said, you know what? It's hard to know what to do, and that's what we're here for. So definitely come to us. We can definitely assess you and see what's going on. And then if we don't have the resources, we can point you in the right direction. And with the relationships we have, we can get it done. And I think it actually was shorter time than if he would have gone somewhere else. And he was quite happy. My duty as a nurse practitioner, the way I see it, is to thoroughly listen to what's going on, take a good history, do a good evaluation, and make an excellent diagnosis and make them feel better. That's what everybody wants at the end of the day, is what's wrong and how can I feel better? And they want to feel like when they come that someone's listening to them and going to make a difference. And I feel like that's what patients want. They want you to hear them out. They don't want to go home with the same problem they came in with, or they at least want a plan. And I feel like that's my role, is to give them a plan, give them maybe the beginning to a solution, getting on the right path to better health. And luckily here we have such an excellent patient population. They're very adherent they want to be healthy. And so when we give them ideas and education and plans for their health, they follow through. And so our patients are very well taken care of. And if they're not, we get them on the right track. I believe my role at Stone Oak is, we're starting to change it. Dr. Phillips and Dr. Catino have a lot of patients that want to see them on a daily basis. And I'm here to get them seen. There's only so many hours in a day. I work closely with all the physicians, but in particular, those two have just so many patients on their panel, and it's frustrating when they have to wait weeks or months to get in. So my job is to get them seen and get them taken care of. And like I said, the doctors and I work closely together, so I know what their plan of care is, and I can streamline that. I can keep it on the same, whatever their plan was when they see those doctors normally, it's continuous, because we talk to each other and keep them on the same train of thought. What I really love about my job, especially here at Stone Oak, is I love meeting the patients. And that's the part that is so different about medicine and working in a clinic, where you can address medical conditions but actually get to know your patient. I see a variety of patients, mostly middle to older patients, and I love all of them, but especially my older patients, because they have the best stories. And they're the most interesting, and they'll just tell you all kinds of good stuff. And that's it.